But if I get elected president, I will bring it back bigger and better and stronger than ever before, and we will make America great again. Thank you. Thank you very much.
2016, year of the snake. Time for a change in the White House, y'all. Bring it.
How's it going, folks? Click the share button, let folks know we are live. We're going to be updating you on all the stuff going on, reopening across the country. There's a lot going on. How's it going, Ann? Good to see you. There's my Amaro. Good to see you, my friends. Hey, how's it going? Good to see you. Welcome, welcome, welcome. All my patriots. I do love my guns. Make America great again. Great again. I am. Hello, Patricia John. Hello. There's my Monkin. Wow, would we love the ability to work a job again, right, you guys? We need more Trump. We're going to need some more Trump. I agree. More Trump than we have now, folks. Hey, Lisa, how's it going? Great again. Make America great again. Make America great again. Again. Because we did it. It was great. America was so great, you guys. And boom. Shutdowns. How's it going, Marita? Hello, everyone. Welcome to the show. You are watching the one and only Trump Talk US live in DC with Suzzanne Monk. I am Suzzanne Monk. We are 8 minutes away from our nation's beautiful capital. We're about 15 minutes away from our president's beautiful White House. It's the people's house. It is the people's house, is what it is. And that's where our president is at. That's all right, Chris. Both work, but this one's easier. Because this is where all the people are over here. We got some folks on. I'm sure my trolls will always stop by on Twitter. You know how they do. So, of course, I want to give a big shout out to the Trump Towel, my good partner and friend, Diane Ventura, working so hard on reopening America. There it is. Boom. Reopen America right there. I know. Would that make sense, Chris? It doesn't do that. doesn't do that. I don't know why I can't control which one goes first. I'll look at it. I'll try to figure that out. So, where to begin, you guys? Where to begin? We're seeing exactly what I predicted seeing all along. We're seeing the Democrats on the slow roll to reopening. Now, this is the problem. This is the problem we're having with everything that we're seeing across the country. And I'm going to talk a little bit about what I did over the weekend so I can give you a sense of what we're talking about. Unless you're all the way open, you're not open, okay? Businesses can't survive on 50% income. So we are seeing the states, even our red states, start the reopening process. I'm happy to see the starting. You guys, but we have to go all the way. We have to be open all the way. We can't do this trickle, okay? So we spent the weekend down in Georgia at the Get Right rally. Lucretia Hughes hosted a fantastic rally down there, the Get Right rally in Georgia. We were there in Loganville, Georgia. It was beautiful. The rain held out for the rally. We got to go to restaurants. It was very exciting. But let me explain to you what I mean when I say we got to go to restaurants, because it's not enough. It's not enough to save our restaurants. It's not enough to save our businesses. So in Georgia, and this is in many of the reopening states, restaurants are now at 50% capacity. They can open for seating, but they have 50% capacity. All the staff, all the waitresses and staff have to wear masks. Now, also all the grocery stores have to wear masks. We're seeing this mask. We're going to talk about masks a little bit later in the show here, because this has to be ended as well. We cannot continue to buy into this false, fake precautionary measure that is not causing any benefit whatsoever, and in fact is probably causing detriment. So we're going to talk about that in just a minute, but I want to talk about this idea of 50% capacity. When you tell a restaurant it can only seat 50% capacity at any given time, you're basically telling them that they will be getting 50% less of their business. Now, that all depends, of course, on their regular business schedule. You know, if they were had a lot of customers, but on a Friday and Saturday night, you know, as well as I do, many of these places have those tables all full. And to tell them that they can only do half of that business is absolutely ridiculous. Now, to add to that, what we're seeing is when you go into the restaurant, when you see everybody in the masks, when you see the tables half empty, you are put in a continued spirit of fear. Okay? This is going to slow down the natural customers coming back in. All right? The customers are going to be seeing that fearful environment, the masks, the spacious tables, and it's going to look like, well, is it really safe? Is it really safe? And that's why they're doing 50% open, you guys. 50% open is a trick. It's a trick. I mean, thank you, Governor Kemp. Thank you, Governor, what is it, Cooper in South Carolina? I can't keep track of them all. No, Cooper's in North Carolina. Thank you, South Carolina, whoever you are. I'm trying. It's a lot of governors, you guys, to remember all of them. You guys only have one to remember. I'm remembering all of them, so be patient with me, please. So it's not going to do the trick. It's not going to save the business. The businesses are not going to be able to continue with these fearful tactics, reducing their customer base while they're already required to only have 50% capacity. So we have to keep pushing, you guys. We have to keep pushing forward. How's it going, Carol? Great spending time with you, Carol, down at the Get Right rally. But Carol, I'm just talking about our dinner at the Long Hard. Our waitress was great. Jessica was fantastic. She was putting up with this mask situation as best she could. But every single waitress I talked to will tell me clearly they're not going to make enough tips off this 50% capacity. They're not going to be able to make the kind of income they were making before. So to expect them to keep those jobs that no longer provide financially for their family is going to be a bit hard. And so the restaurants are going to lose employees, they're going to lose customers, and they are going to lose their businesses. 50% is a slow death. 50% capacity is slow death. Making your businesses wear a mask, making your business where your restaurant owners, your wait staff, your grocery store clerks, making them wear a mask is going to reduce business. It's a fear tactic. It does not in any way whatsoever help you prevent getting the virus or giving the virus. I'm going to read what Loretta just posted because this is tragic. And we're going to see more of this. This is why we need to start pushing back on these mask ordinances and policies, company to company if we have to. It's ridiculous. We need to get off of the masks. We need to stop tolerating this next aspect of the shutdown process. 50% is part of the shutdown process, not part of the reopen process. Loretta says, my son lost his job due to refusing to wear a mask on his personal time. He was also told he couldn't go into open establishments, even though the establishments are complying with guidelines. I'd quit that job. Let him find employees who are going to put up with that crap. Okay? So, and it's unfortunate. All of this has created a complete reordering of the economy. People who had stable jobs in happy positions, they were happy with their company, are now forced to make radical decisions on whether or not they still work for that company based on these ridiculous mask policies. Let's just slowly review why masks are no good. Let me, if I can possibly even, I think I can pull this up. Let me go over here. Let's see if I can't show you an example. Let's see if I can't show you an example of why masks aren't going to help you. We're going to just give me a second. The reality of the situation is that the masks, even the N95s are not 100%. But the N95s are specifically designed for medical professionals who are in a high environment, for paint, for things that are, dust, very fine particles. So let me see if I can find this image. We're just gonna have to scroll a little bit. And I think this will kind of make the paper masks, the masks that we're using, the non-medical masks or cloth masks. These masks are not at all. They're not preventing the virus from getting out. They're not preventing the virus from getting in. And we're going to show you that just a second as I scroll. It's in here somewhere. Patience. Yeah. I post a lot of reopen things, you guys, so it takes me a minute to find where they are at. Scrolling. Okay. I think we're getting closer. The reality of the situation is, I'm really hoping we can find this photo because it will explain exactly in just one image. We'll give it one more second of looking. Hold on. Let's see. Give it one more second of looking. I think Facebook has deleted this post already. I think Facebook does not want me to share this post with you. It doesn't want you to see that when you paint with a mask, yeah, it really doesn't want me to find you that post. When you paint with a mask, okay, the standard mask that you use, you're breathing in paint. You're breathing in paint. There's several individuals who have used that mask while painting, while spray painting, and paint particles are actually smaller than virus, or are actually bigger than virus. So if the paint is getting through, smaller things like viruses are getting through even more. And you will see on these videos and these photos, paint all the way up in the nasal passages, all the way across the face, the cheeks here, all around the mouth, because you're breathing in and out. As you're breathing in and out through that mask, things that are going through the mask, paint particles, are getting in and out of your sinuses. So if you are breathing paint, you're breathing virus. If you're breathing paint, you're breathing the virus. The masks we are asking our waitstaff to wear, the cloth masks, the non-medical blue paper masks, we're asking, the disposable masks, they're not preventing the spread of this virus at all. What they are doing is creating an environment for bacteria, a moist environment in front of your mouth for bacteria, for other, for virus to increase and multiply. Okay, that's why they want you to change it all the time, because you actually are creating a moist environment. We're also preventing free breathing. That has different effects depending on your lung capacity, but it's not something that even on the box of the mask is recommended for extended periods of time. How's it going, Bativa? That's my girl right there. So we should not be requiring anyone to wear a mask. We should not be wearing masks in public. If you are healthy, you should not be wearing a mask. It is not making you less sick. It is not making anyone else not get your germs. Okay? If you are breathing out, right? If you are breathing in and the paint is coming in through your nose, then that moisture, that mist from your mouth, let's say you're talking, the mist, that coming right back out. We're not preventing anything. We're controlling ourselves. We are giving a technique to continue to frighten the public. The masks are to frighten the public. Virginia just put a new mask ordinance up. Ralph Northam is talking about just starting a mask ordinance. They're already beginning to get to the reopen phase. He wants to start a mask ordinance. That doesn't even make any sense. So now at the end, you're like run in and join the club, Northam. Yay, mask ordinance. It's just the reason all of these things, the reason he's doing it, the reason folks, the reason they continue to push them, the reason they continue to push them is because it continues to create fear. That's what they want. They want you to feel the virus still has control. They want you to feel that the virus is somehow controlled by their measures. That somehow they're going to be, the things that they're doing, and this is what they keep saying, oh, well, if we hadn't done these things, if we hadn't shut down, if we hadn't told everybody to wear a mask, if we hadn't cut off non-essential, whatever that means, work, if we hadn't shut the churches down, but left the gay strip clubs open, as we did. If we hadn't done those things, we would have had many, many more deaths. But I see no evidence of that. There is zero evidence. There is zero tangible evidence that any of those measures, shutting down, wearing masks, wiping everything down. In fact, now the CDC is saying that coronavirus does not transmit well on surfaces. So if you get it on a surface and you touch that surface, it's very unlikely you're going to get the disease because it does not cause contagion very effectively on surfaces. We've all been running around wiping, Cloroxing everything, Lysol wiping everything. We've got kids in New York who've been locked in with chemicals so long they're getting Kawasaki disorder. Because we're wiping everything with too many chemicals, keeping kids inside. They're getting irritated. They're getting exposed to the things that give them inflammation, which is what Kawasaki syndrome is. So we continue to cause our own problems. The masks are just yet another opportunity to cause our own problems. Now, look, I understand some folks feel that it is important to wear one to make them other people feel comfortable. I understand. Some folks, your mom, your dad, your family member, your Aunt Lucy, whoever she is, she says, just wear a mask. Just wear your mask when we go shopping. Just please. I understand. But you should understand you're not doing anything. And we need to understand that being 50% open, requiring our businesses to wear masks is not open. That's not open. We cannot stand down and say, oh, well, thank you. Thank you, kind and benevolent ruler, for giving us permission to leave our house as long as we cover our faces. It's a little like Islam, you guys. It's a little Islamic. It's a little burqa-like, to be honest, that we would allow our government to tell us that we have to cover our faces with no medical evidence that is actually viable, that is stopping the spread of the disease. And in fact, medical experts, medical information, even on the box, stating the opposite about wearing masks. So we not only need to get that information out, we need to resist wearing masks. We need to encourage our friends to resist wearing masks. We need to push back on the companies that are requiring masks. A lot of folks are already doing this with Costco. Costco has a mask policy. A lot of my Patriot friends are already pushing back against that mask policy, calling Costco, canceling their membership if masks will be required. Okay? That's what we're going to need to do. You need to do the same for Walmart. We can get Walmart to change its policy nationwide. Rather than go state by state and get the mask ordinance removed, the mask ordinance in many states is a recommendation. It's a recommendation. It's not an ordinance. Many of these mask rules we've seen even in Illinois, across the country, are being enforced by the chain store, not the county or municipality, not the city, not the county, not the state. So we're going to need to go to those companies and say no to this mask policy. We're going to need to go to airlines. Airlines, you guys are requiring masks when you get on the plane. Jeremy Harrell, we had a great time spending, hanging out with Jeremy Harrell. He performed his latest songs as well as his other songs at the Get Right rally. It was a great time, but he flew in and he did not wear his mask. He insisted that he was not going to wear a mask, and he had medical reasons for that, and he didn't have to disclose them. And they did let him get on the plane and off without wearing a mask, but he had to push it several times. It wasn't just an easy one and done defense of your liberty. They asked him several times. They pressured him several times. He had to push back several times to ensure that he was not required to wear a mask. So we're going to have to push back several times. We're going to have to be strong. We're going to have to empower other folks. We're going to have to empower other folks to not wear masks and to push back against the mask ordinance. And we're going to have to reach out to our governors, our mayors, and we're going to have to demand that they end these mask ordinances. And it's an easy ask. I know folks want to fall into the trap of, oh, well, masks obviously do something. They must make us safer. It's a mask. It's over my face. But the science disagrees with that. So each and every governor who is requiring people to wear masks, who is following guidelines that restaurants and businesses should be wearing masks, they need to provide evidence. They need to provide evidence as to why that mask requirement is helping reduce the spread, save lives, lower our hospital capacity. It's actually doing none of those. It's not even doing the dumb thing they want, which is stopping the spread. It's not stopping the spread at all. Doesn't stop the spread. That's great. That's great, Lisa. We're going to put this up. The governor of Texas, I believe that's Abbott, Greg Abbott, says we do not have to wear masks. That's great. That's great. Actually, it is. Let's pull the troll up for the day. Everybody, let's pull a little troll up. Science, in fact, does. Fauci himself, Golf Cam, my little liberal troll. Fauci himself disagrees about the effectiveness of wearing masks. Your own guy disagrees. The CDC disagrees with itself. Fauci just recently, in the last 48 hours, came out with new statements on the effectiveness or lack thereof of wearing cloth non-medical masks. It doesn't do the trick. It doesn't do the trick. See, this is what they always do. They love to pretend. They go, oh, as long as somebody's agreeing with me, he's my guy. But as soon as he disagrees with you, he's Trump's guy. Fauci is a Trumpster. No, boo-boo. No, boo-boo. He's not. So, and yes, in fact, I'm being honest. You should go look it up. You should go and look it up for yourself. The evidence is all there. The information is all there. The previous position by the CDC and Dr. Fauci and the current position, and now Dr. Fauci coming back to his original position, which is the accurate position. Non-medical face masks or cloth masks do not prevent the spread of the virus at all. The only thing you're doing is allowing that sense of fear, that sense of something wrong. We are still not able to show our faces. That fear continues to bring people to that place in their mind where they can continue to stay shut down, where the it's panic inducing. It's literally terrorism. It is statutory terrorism is really what it is. It is executive order terrorism. The governors, the mayors that are ordering these mask ordinances are terrorizing their constituents to stay shut down. That's what they're doing. That's what they continue to do. They continue to, of course, as the left will want to say, oh, there's new cases. Yeah, well, we're testing more. I don't understand what is so bad about everyone on the left is incapable of math. I'm just going to call it. You're all utterly incapable of math. I don't know what happened, but I suspect 2 plus 2 equaling 4 is too complicated for you guys, because you do not understand that if you test more people, there will be more cases. And as you test more people, people who have not developed severe cases, people who have not died in any way, people who have survived the cases very effectively and are now put into the category of, see, they don't even put you in a recovery category because you have to actually have 3 subsequent tests of antibody, of being past any virus in you and only antibodies in you, which I'm not even certain we're seeing that accuracy there. So they never mark you as recovered. That's why we see such low recovery numbers, because the measurement they have for marking you recovered is not an end of symptoms. And anyway, it's some ridiculous 3-4 times testing when we're already looking at so many, we've claimed we have shortage of tests, etc. So when you test more people, you get more results. The death toll, even according to CNN right now, is about 0.5%. 0.5%. That's the death toll of this disease on the American populace. Now, the death toll of heart disease, the death toll of asthma, the death toll of diabetes, the death toll of any of these other conditions, cancer, far more. Regular flu, more. Car accidents, more. So, yet again, the continued fear-mongering, the continued misinformation, and then they love to accuse you of misinformation. Sweetie, if you think you have the evidence to answer these questions I'm asking, provide it. Our governors need to provide that. Our mayors need to provide it. Mayor Muriel Bowser, who is shutting down, who is trickling us, oh, we might reopen a little bit early, some of it, but we're never going to get to stage 5 until there's a vaccine. That's stage 5. Now, a vaccine is going to be something that's 18 months away. The disease, this novel virus, will have already gone through its entire cycle. No one will be getting the virus by then. Fact. How do I know that? H1N1, same. H9N4, I believe, also same. SARS-CoV-1, same. This is what happens with novel viruses. It blows through the population because we do not have immunity, because we do not recognize this virus as being something that's dangerous to the body. So it gets into the body. Our immune system has to come to recognize it over time. As we recognize it over time, we build immunities. That's what antibodies are. Antibodies, once we see the virus again, we go, nope, shut it down. Not letting that virus build up in our body at all. Our immune system immediately defeats the virus. That's what herd immunity is. When a specific percentage, 60 to 80% of the population has built up an immunity. In other words, they've been exposed to the virus. They now have antibodies in their system. Okay? That is what immunity is. You have antibodies in your system. You're not going to get the virus. Therefore, you're not going to carry the virus to vulnerable populations. That's what herd immunity is. Most of the people have immunity to the virus. Thus, it is unlikely that it gets exposed to those people and taken to their family members. We keep pretending like you get the virus and you're exposed forever. Contact tracing is this stupid idea that you get to the virus and now you can toxify anyone for all of eternity. But that's not the case. That's not the case of this virus. That's not the case of any other upper respiratory virus. So, as that novel virus continues to go through the population, many people have already been exposed. We're already finding many more people have already been exposed. So we're actually much closer to herd immunity than we even have been told, because more people have been exposed to the virus than we are admitting to. And this is what testing is showing us. That's why we see testing cases. We continue to see more cases. We're testing for them. But we also see the death rate going down because a smaller and smaller percentage of the population has died from the virus, because we're measuring, we're testing, we're finding out more and more of the population actually had the virus and survived without any symptoms whatsoever. So let's talk to this troll. Let's talk to Trolly McTroll. I can't believe you guys are so cute that you do this research. You are so cute. Why would you not want to trace it though? You cannot. It is physically impossible to trace transmission of the virus. Let me repeat myself right now. It is physically impossible to trace transmission of the virus. Now, I can use my little phone. You can use our little phones to trace where we are. You can track me through my phone. You can track me all over. Know every spot I've been to. You can use that data, okay, to find out who else I've been near. You have no way of proving that any of those people I was exposed to or were exposed to me gave me the virus or vice versa. Because there is no way to test to see the virus go to that person. You could actually have gotten the virus from any number of individuals. You could have gotten the virus from someone who has not been tested and thus would not come up as positive on the contact tracing. Contact tracing cannot trace where you got the virus from or who you're giving the virus to. It cannot. It's physically impossible. It can keep track of you. It can keep track of who you're associating with, but it cannot tell you if you got the virus from somebody or they got the virus from somebody or they got it from you. It can't. We can't see virus transmission. Not every person you get in contact with who has the virus gives you the virus. Let's repeat that because people need to not be stupid. Not everyone you get in contact with who has the virus gives you the virus. Okay? You have to get the virus in your nose, in your mouth, in your bodily orifices, and you have to get enough of the virus. You have to get enough of the virus in your body to actually become sick about it, from it. You need enough viral load. So, as a matter of fact, you could have gotten the virus from everyone you were in contact with who might have had the virus. You could have gotten it from none of those people who had the virus and from an entirely other untested asymptomatic person. There is no way through the science we have today to trace the virus. There is no way. There is no way. 100%. That's why you don't want to trace it, because it doesn't work. And you're just giving up everything about all of your privacy, all of your personal information, all of the right of the government to know and control who you see and where you are. That's what you're giving up for nothing. For nothing at all. Don't trace. Contact tracing is so stupid. Let's talk to Gulf Canada. What happened in the meatpacking plant? Would you like to hear what happened in the meatpacking plants? Would you like to hear what happened in the meatpacking plants? Because I'd love to talk about what happened in the meatpacking plants. That would be a great conversation to have. What's happening in the meatpacking plants is one. We continue to have exposure. We have exposure early on from Chinese individuals who came directly from Wuhan, did not use protection. We've seen that in the Tyson plant. We've seen that in several other plants. Okay? It was an intentional target. It was an intentional target. They intentionally exposed our meatpacking plants. Now, that being said, what happened in our hospitals? Why are our hospitals where the COVID patients are going, why are there not tons of nurses and doctors all sick? The meatpacking plants, everybody got sick. They were using PPE. They were using social distancing. Everybody got sick. Hospitals, they're using PPE. They're using less social distancing because they're treating the patients, much less cases of being sick. So you tell me what happened in the meatpacking plants, which oddly then utterly undermines the food chain in this country. Yeah. The left thinks we're not aware of what they're doing. The left thinks we're not capable of seeing their plot and their plan. But the plan has been unfolded so very obviously, it's ridiculous that they think we can't see it. It's ridiculous. Utterly ridiculous. That's why they went after restaurants and schools, because they knew that would affect our food chain. They knew that our food chain is predominantly our farmers, our meat packers, are predominantly producing food for restaurants. They knew that we had already set up regulations that would make it difficult for those farmers to get access to putting food directly on the store shelves. Why? Because like your eggs, for example, need to get that little stamp on the egg. They need to go through specific procedures for the USDA here in the United States to be sold at a grocery store. They go through different procedures when they're sold as liquefied eggs to be sold to restaurants. Totally different whatsoever. So this is what we're seeing. We see an intentional attempt to break the food chain, the ability to get food to the grocery stores, that actually then affecting the starvation of the rest of the world. The UN itself predicts 30 million children will starve this year. 30 million children. additionally will starve to death this year from these shutdowns. Up to 500 billion people will be put onto the lowest level of poverty, $1.90 a day. Millions of people, 131, 141, 175 by some, will be put on starvation level income and food supply because our food chain is being broken. And we want to play games about the meat plants. We want to play games with the left. The left wants to play games. Like we're not clear on what they're doing. We know what you're doing, you idiots. We know what you're doing. This is why this is why this. Yes, Virginia, you're 100%. 100%. Finding ground beef in Maryland is a miracle. I finally did find some for $10.89 a pound. $10.89 a pound. Now, if you are in a farm region, you can, in fact, go to these. Some of these farmers are starting to find ways to sell directly to the public, farm stands, etc. If you have the freezer, if you have a freezer, you can order a nice bulk of meat. But for the vast majority of people who are in the cities or in urban environments, it's going to be very difficult for them to find meat that isn't going to continue to go up in price. Up in price. And we're going to see that everywhere. This is unfortunately what we're going to continue to have to fight. We're going to have to continue to push back. And this is why we talk about the masks not being a reality and pushing back on the mask. Part of what caused the meat packing plants to have such problems is we put them down at 25% capacity so that we could create this social distancing. Well, it's not feasible in their business model. It's not feasible at all. In fact, what could have been done if these PPE equipment, if this equipment is supposed to be so great, we could have and should have provided equipment to our meatpacking workers immediately, early on, from the beginning. Unfortunately, we have a lot of our meatpacking plants, a lot of our farms have been bought up by Chinese investors. Smithfield, Tyson, big meat company names, owned, operated, and controlled by Chinese nationalists. Chinese nationalists who obviously have an agenda. They obviously have an agenda that they are trying to implement. So we need to be very cautious. We need to find ways around. We need to start pushing back on every aspect of the shutdown. Every aspect of the shutdown. By doing so, we start to prevent more damage that we're seeing. The fear and the panic are increasing the damage. That's why we're talking about pushing back. That's why we're talking about not wearing masks. That's why we're talking about acts of civil disobedience like we're seeing out in California, where they're taking down the fences that are put in front of the beaches. We need to say no. No more. No more shutdowns. No more fake precautions. Show us the evidence why this precaution is necessary or end it today. And I don't mean one study shows me one little thing, because, that's what they're doing lately with the hydroxychloroquine. Okay? It's so frustrating for those of us who actually studied science, who studied research, who studied statistics. It's so frustrating because we see newsies, little journos who have the IQ of a pea, try to tell us, well, there was a study done where giving patients hydroxychloroquine actually was more likely for them to die. Well, guess what? They only did that study on, I believe it were 38 individuals who were near death at the VA. They paid a lot of money for that study. But in no way does this one study match or represent the thousands of cases that we are seeing doctors talk about. The thousands of cases that we have from clinics and medical professionals around the world who are seeing the results of hydroxychloroquine, not to mention the science behind it, which is in fact sound. So once again, we have a media who, rather than push facts, wants to push one study. Exactly, Bethia, exactly. One study proves nothing. Science is not measured by one study. Science is measured by studies that repeat those same findings over and over again. And what we're seeing is this study is actually an anomaly. Because what doctors are reporting is that they're seeing high levels of success with hydroxychloroquine. And in fact, prior to this whole panic induced by our friends with investments in the pharmaceutical companies who would much rather sell remdesivir for $1,000 a pill than hydroxychloroquine for $1 or less. Now they've decided President Trump is running pharmaceutical companies that sell hydroxychloroquine. Okay, you guys, this is a common medication. It's been around for 40 years. President Trump is not buying up hydroxychloroquine plants to make his millions. That's the most ridiculous. Every single news story is the same. Every single news story pushes another lie that is opposed to the president. None of these news stories talk about actual health. They talk about real results. They don't talk to the doctors who disagree. They only talk to the doctors who disagree with Trump. We need to start getting rid of these journalists. We need to start getting rid of this fear. So what I'm calling on each and every one to do, I know we do calls to action on Reopen America all the time. I'm going to ask you to go to Reopen America, check out our call to action. We have a fantastic new call to action, reaching out to our sheriffs and our district attorneys, demanding they support the Constitution and end these shutdown orders. All the information you need to understand that, to work on that, is right there at Reopen America. Calls, reopenamerica.org, calls to action. Reopenamerica.org, calls to action, all one word. You can go and just click on the calls to action tab on reopenamerica.org. Find out more about this. We're so happy we get a chance to work with the National Liberty Alliance, who wrote The Power of the County Sheriff. The link to their site is there. So you can go and find out more on the calls to action page about the National Liberty Alliance and all of the great stuff that they have, all the great resources they put together on rebuilding our constitutional government as the founders intended, through the power of the sheriffs, through the power of local government, through the power of committeemen. Great information. I'm going to ask you to join them. They have wonderful resources and sites. They do videos on a regular basis, and we are basing our power of the sheriff, our call to action, off of the information that they've provided. So I'm so excited to be working with them. Please go to the call to action. Please check out their website on the link there, The Power of the County Sheriff. That will give you more information about the National Liberty Alliance. Great group of people, and we certainly stand and support them and what they are doing, and their support of us, their support of continuing to get the word out to people that we can call our sheriffs, we can call our district attorneys, we can write emails and letters and let them know we want them to enforce the Constitution and stand down against these unconstitutional orders. But I'm going to need you all to do something else. No matter where you're at, no matter reopen, open, if there is any rule in your county, in your state, if the businesses are still wearing masks, I need you to find out why. Is the state telling them to do that? Because if the state is telling them to wear masks, I need you to email, call, write your governor, and tell him no. We should not require workers to wear masks when there is no evidence that it is making them safer or making us safer. No to the mask. Write your governor, write your mayor, write your county board. Tell them you oppose that. If you find out it's the business, if it's Walmart, if it's Costco, whatever store it is, whatever chain store it is, I want you to call corporate headquarters, and let them know you will be rescinding your membership. You will not be shopping anywhere where a mask is required. Any store that has a mask policy, we need to let them know we are not shopping at that store. Any store that has any policy other than reopen normal, 100% like it was before, Suzzanne, how can you say that? How can you say like it was before when nothing is like it was before? Okay, the only thing that wasn't like it was before is we've been lied to, we've been misinformed, we have been told false numbers, we have been given false science, and we have done all that so we shut down our jobs. So why would we continue to believe in the lies, the misinformation, the false science, and the political manipulation once we know those things are fake? Reopen. We should be entirely reopened immediately. Yes. I don't know how many times I can say it. We should immediately, right now, as of today, no mask ordinances, no social distancing, no 6 feet, no stickers on the floor, none of this, no plexiglass, reopen completely today. None of these measures we are doing are slowing or stopping the spread. They won't ever slow or stop the spread. The virus itself is going to run its course, and we're finding it far less deadly than we were told. We were lied to. This is a mild flu at best. We don't do any of these measures for the flu. We don't. Stop complying. Start complaining. Stop complying. Start complaining. All right, folks, I'm going to cut out here. Just a few minutes early, I'm going to be on the Exceptional Conservative Show with Kenneth McClinton tonight, so I got to get ready for that interview. I want to thank you guys for tuning in to my show tonight, Trump Talk US. This is our Reopen America catch-up. Every Friday is going to be the Reopen podcast. We're going to catch up here on reopen efforts across the country. I will be in Virginia tomorrow, in Manassas, speaking at the Prince William County Reopen event, so I'm excited to be there. And we have our next Reopen DC event on June 7th, Sunday. There's a Sunday, so lots of folks can come out, 2 to 4 p.m. Muriel Bowser, she's starting phase 1, but phase 1 is death. And phase 5 is we have to wait for a vaccine. So none of that is acceptable. So we're going to be talking tonight with Clinton, with Kenneth McClinton, and that's what we're going to be talking about at our Reopen DC rally on June 7th. So I hope to see you guys there. We will be sharing that there. Thank you for sharing me an article-based diva. I will be back here on Monday, 8 p.m. Eastern Standard Time, possibly 9 p.m. I think I'm going to 9 p.m. You guys keep it. I'll share with you on Monday what my final decision is. But until next time, everybody, I love you. Please keep reopening your country. Please go to reopenamerica.org. Find out how you can help us. Thanks for your support. Thanks for your help. Your freedom is in your typing hands, you guys. Make those calls, make those emails, and I'll see y'all on Monday. Until then, this is your girl, Suzzanne Monk. Trumping out.